So whether you're nearsighted, farsighted, or have astigmatism, ICL is typically a great option for you. The ICL comes in all kinds of powers for all prescriptions out there. Typically, we use it for people with higher prescriptions, those really nearsighted people. See your doctor. They may be able to decide that even though your prescription isn't that high, your cornea may not be ideal for laser refractive surgery, and in those cases, ICL may be the right option for you. So the ideal candidate for ICL is typically a patient with a really high prescription of nearsightedness or astigmatism, the kind of prescription that isn't ideal for laser refractive surgery because it would thin and weaken the cornea too much. There are people who have smaller prescriptions, but the cornea themselves are not ideal for laser, whether that be too thin or too weak, and of course we don't want to thin it even further with laser, and that may be an opportunity to implant an ICL to still get great vision. If your cornea is even weaker, there are people who have what we call keratoconus. It is a disease of the cornea where the actual cornea itself is misshapen, and in those cases, laser is definitely not the right option for you. And again, as long as it's stable, ICL may be a better choice. There are even patients who have such bad dry eyes that you really don't want to, again, mess with the cornea because dry eyes can get worse in those cases after laser. And again, ICL may be a right option for you, but of course, you should consult with your doctor. So really anybody 19 years old and up is a great candidate for ICL depending on your prescription. So typically ICL was reserved for people with really high prescriptions, your super nearsighted people, lots of astigmatism, or people whose corneas themselves were really thin or were very weak and were not a good candidate for laser vision correction. As the safety and the efficacy of ICL has continued to improve through advancements in technology, more and more people are having ICLs even though they have smaller prescriptions, and it's still working out beautifully. So the huge majority of patients are great candidates for ICL, but there are of course some people who may not be a good candidate for the ICL. The first one is if your prescription is really, really low, it may not even be necessary to do an ICL. You may be a great candidate for a simple laser refractive option like LASIK or SMILE. However, there are also people who don't have a lot of space within the eye. The anatomy doesn't allow for placement of the lens. It's essentially too tight of a fit, and those cases may not be great candidates. At the same time, if you have, let's say, other abnormalities in the eyes, whether there's high pressure in the eyes called glaucoma, or there's already lens changes called cataracts, either because of natural aging process, or there's just some congenital changes from a younger age, you may not be a great option for ICL. Of course, that's why it's so important to speak with your doctor to see if that's the right option for you.